Hello, and welcome to Office Hours, where I answer your questions about weight and weight medicine. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, if you have questions about weight medicines, and if you want medically based, fact-based answers to your weight questions, you are in the right place. Welcome. Before we get started, as always, I can't answer personal medical questions because I'm not your personal doctor. So if your question does lean a little personal, I'm going to change it so it's more broadly, educationally applicable. All right, first question. I have been on Wegovy for 6 months and only lost 16 pounds. Now I'm on Zepbound for 2 months and no weight down or inches off my belly and arms. What should I do? Okay, so of course, my first answer is going to be, you need to check in with your physician and have them go through all the reasons why. There are many different reasons, and I made a lot of videos about this, why your weight loss might be stalled. But I will say that when I am changing somebody over between medications, I tell them that at this time, you might not lose weight and you might actually gain a little bit of weight, and the weight loss might not kick in for a little while. And I'll tell you why. So for me, it's really important that patients know that and they can be patient, because otherwise they're going to really worry and think that something's wrong. Now, let's say I have a patient and they are on Wegovy 2.4. They are tolerating it fine, but their insurance said, okay, we are not covering this anymore. We're going to cover Zepbound. So if I'm switching somebody at 2.4, again, this is my average patient, 2.4 to Zepbound, I'm not going to change them to Zepbound 15 milligrams because I don't know how they're going to do on that. I'd much rather back down a little bit, make sure that they're not going to get blasted by Zepbound, okay? Zepbound is a more potent medication. So usually I'll put, depending on the patient, depending how well they've tolerated it, I will usually start them at Zepbound 7.5. If they've had a lot of side effects or they're especially sensitive, I might just start them at the 2.5. Again, depends on the patient. But for the average patient, Wegovy 2.4, I'll usually go to Zepbound 7.5, and I will say, hey, because we're going to a potentially lower dose, because I want to make sure you're tolerating it well, you're not having a lot of side effects, it's a different medication, so who knows how you're going to actually respond to this. I want to make sure that you can tolerate it, because the most important thing is that you can stay on this medication and you don't hate your life, and because these medications are forever. So, hey, you're going to go down a little bit. We're going to take a couple steps backwards dose-wise for you, because that's the safest thing. Now, you may not notice any weight loss for this month or the next month. And so I don't want people to think that something's gone wrong. That's what's expected. It just takes, it's just the best, safest way that I have found to transition people. But it can be very confusing to patients if they are not aware of that. So that is a great question. But yes, definitely check in with your doctor. It might be time to get some labs done. Next question. I've been on Zepbound for 14 weeks and have lost 30 pounds. I'm a 61-year-old woman and I'm currently on 5 milligrams. Okay. My calorie intake, because of the appetite suppression, is between 900 to 1200 daily and always getting between 80 to 110 grams of protein. I feel like I obsess about what I'm eating to make sure I'm getting what I need so I won't have a weight stall. I'm also constantly thinking about what food I should have in the house so I will succeed and stay on plan. Is this food noise? Even though I am being successful with my weight loss, it can be a lot of work. This is a great question, and I think it illustrates kind of the boundaries of, tracking things and the burden with that, with just the efforts of being, engaging with food in a different way. And people's tolerance for that is going to be different. So when people go from not being on this medication to being on this medication. A lot of times it requires them to think about food differently, to plan for food differently, to think about protein, all these things that they may not have really thought about before, and to get organized in a way that they maybe haven't ever been with regards to food. A lot of people have a very chaotic relationship with food, and they're really like in scavenger mode all the time, even though, financially they have the means to afford food. It's just they're not organized to plan meals or plan like balanced meals, or they're just always reaching for convenience food. So a lot of times people do find that being on the medication means also that they really need to change their lifestyle, which is great and what we want for people. But I also think that these medications, because of how the GLP-1 medications work, they really do strengthen the signal from the stomach to the brain in terms of fullness. So for my patients, I actually find I don't require them to calorie count unless they want to. I really feel like this is a great time to really start to listen to your body in a way that you probably haven't before. And the signal is so much stronger with the medication that you really can't ignore it. And of course, everybody's different, and you want to make sure you're getting enough food, and you want to make sure you're getting enough protein. Those things are always very important, and I've made a lot of videos about that. But those topics aside, in terms of adequate nutrition, adequate protein, I think it really depends on the type of person you are. A lot of people love to track things, and they find it very liberating and freeing. And that's a good thing to know about yourself if you're one of those people. But I find a lot of people aren't. And so what I love, and if you've never read the book Intuitive Eating, it's a great, fabulous book about, it's kind of like an anti-diet culture book. So if you struggle with diet culture in your mind, regardless of your BMI, you should definitely like pause the video and go order that book and then come back and watch the rest of this video, because it's really, really good. And I'll put a link to the book down below. But I really feel like with these medications, people can actually, they can track less and really just listen to their body, listen to when they're hungry, listen to when they're full. Also, as the dosing is changing, that's going to change a bit as well. So it's really important that they're in tune with the changes that are going on and not just kind of treating their body like a robotic project that will always be the same from day to day. Like, we are human beings. We don't, like, our energy needs are not exactly identical every single day. And so I think it's really important that we get back to how we came originally programmed. And in most other countries in the world, they are not counting calories either, and they do not have the problems that we have here. So that's where I start with a lot of people. I think it's about, you as a person, and if people do find that it's very burdensome, I always recommend that book, Intuitive Eating. And then just making sure that a patient is familiar with their hunger and fullness, but definitely talk to your doctor more about that if that's something you're struggling with. People can always see a nutritionist if they want to get more details about that. But yeah, I don't think, I don't like to have things be oppressive for patients, because it just won't work if it's too complicated. Okay, next question. I noticed that leading up to my period, I gain around 3 pounds of what I assume to be water weight. I take a diuretic at this time to help with this, especially since my cramps are horribly painful during that time of the month. I'm on 7.5 of Zepbound since June 2024, not on birth control, and I drink 150 ounces of water per day. I've lost 50 pounds so far. Congratulations. Is there anything else I could be doing? It feels like there's more water retention for the time of the month since being on Zepbound, but I could just be paying more attention now too. Okay, so again, I can't answer personal medical questions, but in theory, or what I would tell a patient, I do think that people are, when they're on these medications, they are tracking their weight more, and they are going to be noticing fluctuations. And especially for women who are getting their period regularly, you might notice a very clear pattern of, okay, yeah, My clothing fits a little different a few days out of the month. The pounds go up a little bit a few days of the month. And I think this is an opportunity to be aware of those patterns, but I also don't want to pathologize human biology because women have cycles. Those cycles can affect their appetite, it can affect their mood, it can affect their hunger, it can affect their weight. That's pretty normal. And so I think we also need to just allow for fluctuations that are a normal part of biology. And just be aware, but it's not, normal fluctuations. For if I have a patient who comes in and they notice around their period, they're gaining a couple pounds and then it goes back down, I'm not really worried about that. That's just their body doing what their body does. Now, for people who want to have less bloating, I think it's always really helpful to see, okay, am I doing anything else around that time? Maybe I'm exercising less and I could actually try exercising in a different way that might be helpful to reduce the sort of bloating type of symptoms. Salt is really important. Anytime people have bloating for any reason, really watching and lowering the amount of salt that they're eating can help a lot. Same with processed foods. Really, if you're eating processed foods at all, I would really try to limit it around that time of the month specifically. And I may have a patient really notice a difference with that as well. So all that is to say, I don't want to pathologize normal fluctuations that women have. That's just what happens. That's totally okay. It's what's supposed to happen. But does it mean that it has to be completely unpleasant or that you can't do anything about it? No, not at all. So watch the salt, watch what you're eating, see if there's a different way to exercise that might be more comfortable for you, watch the processed foods, and go from there. So thank you so much. What an excellent, excellent question. Okay, next question. My doctor is having me eat my current weight in kilograms times 0.8 to 1. Okay, so I'm guessing that they want them to be between 0.8 to 1 gram of protein per kilogram body weight per day, which is about 84 grams. Why do fitness and weight loss influencers have people eating significantly more? They would have me eating 120 grams, which is hard to get in. And why do doctors differ in their approach to how much protein a patient should have? Okay. This is such a great question. The protein recommendations, if you go on the internet or social media, are all over the map, right? And it really depends on the source that you are looking at. Now, for me, if I'm talking to a patient, I am usually going to tell them, for the average patient who is looking to lose weight, a great protein goal is 1 to 1.2 grams of protein per kilogram ideal body weight daily. Ideal body weight. That does not mean the body weight they are starting at. That means let's say if they're at 220 pounds and they want to get to 150 pounds, I am translating the 150 pounds to the weight in kilograms. So I'm taking their ideal body weight, the 150 pounds, dividing it by 2.2 to give me their weight in kilograms, ideal body weight in kilograms. Then that will give me, and then I'm multiplying that by 1.2. That's going to give me the range of protein per ideal body weight per day. That is a pretty generally accepted medical range. That is what the Obesity Medical Association uses as well. Now, again, if people have really significant amount of weight to lose, or there's digestive issues, or they had a more complicated bariatric surgery, that number may change. But for my average person on a GLP-1 medication, I'm going to use that formula. And I don't know why people would use other formulas. Protein is really important, not only for helping with that feeling of fullness and satiety after a meal, keeping you fuller for longer, but it also helps build muscle. These are both very important for weight loss. So protein is very important. As one very astute viewer pointed out, other people might be using pounds instead of kilograms. I also think a lot of times people are using current weight and not ideal body weight, and that's going to be really different. If I'm using that formula for someone who's at 220 but wants to be at 150, but I'm using it for them at 220, that's going to give me a very different range for them. So I think that could be happening as well. I also think it depends on what somebody's goals are. I think there are some fitness influencers who are more focused on bodybuilding. And I think now I am not a bodybuilder, and most of my patients are not bodybuilding. So I'm not really talking to that population of people. And I think also there are some practices in bodybuilding that are, shall we say, like a bit more experimental in terms of supplements used, off-label medications. So I'm not going into any of that with my patients, nor am I using it for them. But I think that it wouldn't surprise me if the numbers were slightly higher or different if people were addressing that population, because it does tend to be a little bit more experimental. So if you are hearing different things, please feel free to leave them in the description box down below. But that's what I use. That's what the Obesity Medicine Association uses. And that's what most doctors that I know use as well. And again, there's a bit of wiggle room depending on what somebody's nutritional needs are. If they're having surgery, there's a lot of other things you have to take into account, but that's really my go-to place for people. But I would love to hear if you have been told differently. So that's going to do it for today. Thank you so much for watching. If you have a question afterwards, you can definitely leave it in the description box down below or on another video, and I will find it and add it to the list. If you are on a GLP-1 medication and you feel like you don't want to waste the window of opportunity you have to make the most of it. I do work with people around the world as a life coach to help them with the non-medical aspects of their weight loss, especially for people who are already on a medication. There are a lot of other factors that are really going to help you get your money's worth. So if you're interested, I will leave all that info down below and we can have a consult and chat more about it. Thank you so much for watching, and please be well.